يعطيكم العافية. This will be lecture 3 of the antimicrobials. We will be discussing the antibiotics that target the DNA. زي ما حكينا this will be the last lecture. المحاضرة الجاية فيها جزء بسيط أولها قبل ما ندخل بالclinical microbiology that will be included in the mid, and then we'll be finished. محاضرة الأسبوع هذا من immunology will be also the last immunology lecture that is included in the mid. But let's continue. So what we're seeing here is we have many ways that you can target the DNA and prevent the DNA from being transcribed to RNA or being replicated or being replicated, synthesized, or being turned into mRNA. فهاي النقطة يعني إحنا قبل ما ندخل بالترانسليشن this is our target area. So the inhibition of precursor synthesis اللي هم precursors اللي بنستخدمهم to make building blocks for DNA, to make nucleotides, we need precursors, and these are targeted by the sulfa and trimethoprim هلا بنحكي عنهم, namely the folic acid synthesis. راح نحكي بعدين عن DNA synthesis, actual DNA synthesis with actual enzymes, which is targeted by the fluoroquinolones, which in this case this is cidal. This would be bactericidal. The precursor synthesis is static. Inhibition of mRNA synthesis, if you inhibit mRNA synthesis راح نشوف زي الريفامبين, راح نشوف كمان this is also bactericidal. Alteration of cell membrane function راح نحكي عنه بعد ال DNA, بعضهم منهم polymyxins ودaptomycin. These are obviously بما انه cell membrane this will be bactericidal. And then نحكي شوي عن من ضمن نجمع ال antimicrobacterial agents مع بعض, and then إن شاء الله we'll be finished. So let's start. Inhibition of nucleic acid synthesis, as we mentioned. We have the sulfonamides and the trimethoprim, both work on folic acid synthesis at different sites. السايت الأول اللي هو inhibition of folic acid synthesis as a راح نحكي عنها لو وجهكم إياها الصورة. So both this one acts as a competitive inhibitor of PABA, راح نحكي عنه هلا, and this inhibits folic acid synthesis by inhibiting another enzyme راح نحكي عنه dihydrofolate reductase. So usually these two are given together, sulfa-tri بسموها, sulfamethoxazole and trimethoprim عادة بنعطوا مع بعض. Because why? If you inhibit, إذا فكر فيها أنت مثلا, I have a precursor synthesis and I'm targeting the synthesis at two different sites. It will be much harder for bacteria to develop two different mutations that target two different areas at two different enzymes simultaneously in the same cell. فإذا بتحط مثلا اثنين مع بعض, ممكن بعض الخلايا may develop some resistance to sulfonamides, but they will be sensitive to trimethoprim. بعض الخلايا ممكن تعمل resistant to trimethoprim but still be sensitive to sulfonamides. It is very hard to have two mutations at the same time that work يعني magically at the same site because of the randomness of mutation. فthat's why عادة نعطيهم مع بعض. used in combination together for UTI. عادة أكثر شيء بنستخدمه لهم هو ال UTI, وكتير ناجحين بال UTI. They target the gram negatives mainly أكثر, يعني gram positives are far and few to cause UTI, لأنه أغلب ال UTI are caused by gram negatives that are in the زي ما حكينا in the gastrointestinal tract. Gastrointestinal tract, bacteria موجودة بال gastrointestinal tract that contaminate the area of the urethra will travel up. فأغلبهم راح يكونوا motile. They will travel up the urethra and then cause an infection in the supposedly sterile bladder. فهذا هو mode of action of UTI. They also work, the sulfonamides and the trimethoprim راح نحكي, they work on Haemophilus influenza, another gram negative. بيشتغلوا على المرسى. You can help targeting MRSA with it. وراح نحكي عن pneumocystis pneumonia قدام شوي. Fluoroquinolones, they inhibit synthesis of DNA by inhibiting DNA gyrase, which is what you need to unwind the DNA, so you can't replicate the DNA, and that will be bactericidal. أكتر أدوية اللي هون مشهورة اللي هو سيبروفلوكسيسين ليفافلوكسيسين، أكيد سمعتوا عنهم. بسموه سيبرو يعني من الأدوية اللي that is very abused خاصة بدولنا. يعني أي واحد بيعرف السيبرو بروح بيقح له قحة بنزل على الصيدلية وباخذ له السيبرو. It actually works because of the high, it has a broad spectrum of activity. Ciprofloxacin is used to treat طلع من GI tract with the gram negatives to UTI to even respiratory infection. So levofloxacin بيشتغل على respiratory أكتر, and especially those that work if you find penicillin resistant strains of pneumococcus. Flucytosine inhibit synthesis of thymidine by inhibiting the enzyme that produces thymidine. So obviously you will not be able to produce DNA this way. And this is بنعطى هذا مش antibacterial بس بنعطى مع الانفوتريسين B for cryptococcal meningitis. Cryptococcus is the classic fungus that causes meningitis. راح نحكي لما نحكي عن بحضر محاضرة meningitis. We have a representative of every shape and size of bacteria that can cause meningitis. عندنا بالجرام positive cocci عندنا pneumococcus, بالجرام negative cocci عندنا المننجوكوكس, عندنا بالجرام positive rods. ما عندنا gram positive rods really, but we really can mention the listeria here. It causes meningitis. And then in the gram negative rods we have Haemophilus influenza. Now in the fungi we have Cryptococcus meningitis. فكل واحدة منهم عندنا representative that can cause meningitis. And we really need to know all of these. Rifampin حكينا, this is one of the ones that are used with isoniazid ضد tuberculosis. عادة الناس بتذكروا rifampin R with RNA synthesis, so rifampin RNA synthesis to inhibit RNA polymerase, and obviously that would be bactericidal. So from this, let's talk about, let's see where we can fill in some details. What is the precursor synthesis? وحكينا هون, this is synthesizing the building blocks that is used to make DNA. ليش هو static وليس sidal? Because it may have previous building blocks that are already made. عندها already هذا, ممكن try to recycle old material. فكان recycle old material, reuse them. فبما انه انا recycling, اذا انا مثلا عندي خلينا نحكي عندي 100 طوبة وانت منعتني انا ابني طوب جديد, فبدي ابني هالبيت انا I can only build 100. فممكن اكسر ارد ابني but I will never exceed 100. البيت يكون حجمه اكثر من 100 طوبة مثلا. If you stop this drug اللي هو سلفونيلستاتيك, انا برجع اعمل طوب جديد وبصير اكبر بيتي, بصير 200 300 400 طوبة whatever. So these are the building blocks. That is why this is a static rather than a sidal. فالسلفوناميدز هم يعني يعتبروا the first compound عادة that is clinically effective against as an antimicrobial. كنت بقرأ بأحد الكتب التاريخية وبحكي عن إنه مثلا إنه يعني أول ما طلع سلفوناميدز it was just so much magic يعني يعتبر, وإنه بس بحكي إنه they kept using it for everything, and then people were starting saying this is not a magic drug, you can't use it for everything, because it was really the first thing that you can give someone with an infection. So their main method of action زي ما حكينا to precursor synthesis blocking, either alone with حكينا with combination. They are used to treat urinary tract infection is the main thing. حكينا otitis media by this H influenza, which is Antimicrobials, gram positive and gram negative. Shigellosis, nocardia, also we can target nocardia as well. In combination, they can also the drug of choice with two additional diseases, toxoplasmosis and pneumocystis pneumonia, which are both parasites. ليش؟ لأنه إحنا قاعدين هم نشوف هنا something new because we can target everything with this drug because everybody uses folic acid. Everybody needs folic acid. How? The mode of action is to block the synthesis of tetrahydrofolic acid, which is required as a methyl donor in the synthesis of nucleic acid precursors, adenine, guanine, and thymine. So you need it for all of them. And they are structural analogs of PABA, which condenses the pyridine compounds to dihydroteroic acid, which is the precursor for tetrahydrofolic acid. أنا بوريكم صورة. So sulfonamides compete with PABA in the active site اللي هو الانزيم اللي هو dihydroteroate synthetase, which this competitive inhibition can be overcome إذا كيف؟ إذا أنت بتزيد البابا or يعني it is reversible, it's not irreversible. So this is another اللي هي اللي حكيناها بالنقطة الثانية إنه أنا برجع ببني الطوب بعد ما تشيله عني because this is not irreversible, this is reversible, so I can keep building blocks once PABA is in excess. فهي قاعدين نطلع إحنا هنا. So this is your PABA, para-aminobenzoic acid plus other compounds. If you use dihydroteroate synthetase هيو, you can make the dihydrofolic acid DHF and THF. This is what you're trying to make, and this is the final product. So you inhibit the first step من PABA, the DHF, by the sulfonamides, by inhibiting dihydroteroate synthetase. The DHR, the HFR, dihydrofolate reductase is inhibited by trimethoprim. These are the two sites that are blocked by these two drugs. So the basis of selective action, is this selective? So we will see that it's not that selective because أنا كمان خلاياي uses these enzymes or similar enzymes. So the basis of selective action on bacteria is that many bacteria synthesize their own folic acid from PABA, and human cells require preformed folic acid as an exogenous nutrient. بس احنا بنشوف ان هدول الادويه ما بتنعطى بالحمل، اذا بتعرفوا الحمل كثير مهم يكون عندهم folic acid. So because they might reduce the amount of folic acid, and then we can see that we may actually benefit from these enzymes to make more folic acid in our bodies. So human cells therefore bypass this step, which is the sulfonamide act, but we know this is actually زي ما حكينا can also affect us in an indirect manner. So bacteria cannot use preformed folic acid; they have to make their own. So the ones that can use preformed folic acid, obviously they will be resistant to these drugs. The P amino group on the sulfonide is essential for it. طبعا ما بدنا يعني مش ندخل كثير بالchemistry. However, drug related fever هاي نقطة مهمة. Any drugs that have sulfa group on them, it's not only these groups, are one of the common causes of erythema multiforme, which is the severe form, and its severe form, Stevens-Johnson syndrome. These are things that target the skin and then cause a wild rash all over the skin, and can cause even the skin to epidermis to separate at the more severe cases. And this is sort of an auto-inflammatory reaction. طلعوا هاي من الأدوية القديمة جدا. سلفا drugs they used to be given in wars، إنه إذا واحد بنجرح بالحرب حط عليه سلفا drug ولفها بس that's it. So all you need to do. طلع مثلا هون 12 tablets، هذول كانوا بينعطوا للميدكس بالحرب العالمية الثانية. So directions: if wounded خد لك 2 tablets every 5 minutes until all tablets are taken. So even the use is quite different. So this is part of the history of medicine. So it really affected the mortality rate خلال الحرب العالمية الثانية. فكان جنود الاليز الحلفاء أكثر chance to go back to fighting is لأنه أقل chance يصير عندهم infections because they had access to sulfa drugs. Whereas obviously the others did not have this benefit. So trimethoprim also inhibits. ما في شيء جديد هنا. The specificity of bacteria is based on the greater affinity for the bacterial rather than the human enzyme. So obviously it can target our enzyme. So they would have higher side effects. So حكينا the combination إنه bacteria mutant resistant to one drug will be inhibited by one or the other, and the two drugs can act synergistically زي ما حكينا مثلا aminoglycosides with beta lactams. So 1 زائد 1 يساوي 5 أو 7. So they give a higher result when used together. What else? حكينا what they are used to treat side effects, hypersensitivity زي ما حكينا, Stevens-Johnson syndrome, severe skin reaction, and the most common cause is sulfa drugs, which is sulfonamides, is one of them. This is a very severe form of Stevens-Johnson syndrome. So you can see it targets the mucous membranes and the skin, and it is actually a dangerous reaction. Other side effects, أي شيء that targets folate حكينا can't be used in pregnancy because it targets folate, فبتعمل neural tube defects. هاي neural tube defects منهم كمان cleft palate and cleft lip. So neural tube defects is I'm sure you have taken in pathology. So يعني إنه the spine is not fully formed. Sometimes the meninges will pop out of the spine and will form this defect in the spinal in the development of the spine. هلا نحكي عن DNA synthesis. مين هم الأشياء تبع DNA synthesis? The main one is fluoroquinolones زي ما حكينا. The Cipro, the Levo. So these are bactericidals. Obviously خاص من هون طالع احنا على البكتيريسايدل. That blocks bacterial DNA synthesis by inhibiting اللي هو topoisomerase, which is called DNA gyrase, that are used to relieve the supercoiling بالDNA. So as you are يعني في محاضرات عندي موجودة على اليوتيوب about DNA replication. You can look at them and see what DNA gyrase is used for. So commonly used fluoroquinolones اللي هم Cipro, Levo أكثر إشي. حكينا they have a broad range of action against many organisms because كلهم عندهم DNA gyrase. All of them will need DNA gyrase. زي ما sulfa drugs have a wide spectrum of activity. So they are used again GI, lower respiratory tract, urinary tract, حتى soft tissue infection. They have a good excellent tissue penetration. هاي نقطة كثير مهمة. يعني الدكتور اللي مش عارف وين الانفكشن مظبوط شو هو upper lower هل هو GI أبصر شو عادة they turn towards Cipro because it has an excellent tissue. يعني زي ما بتحكي يعني the antimicrobials for dummies. إذا ما بتعرف شو تعمل بتعطي Cipro. obviously this is at the beginning was more successful, but then obviously that can increase resistance patterns. early generations اشتغلوا أكثر على gram negatives, بعدين صار السبكترم أكثر على towards gram positives. And nalidixic acid, which is also a quinolone, is much less active and works on gram negatives and is used for the treatment of urinary tract infections. Why? Because حكينا زي ما حكينا gram negatives are the main bugs that cause UTI. Fluoroquinolones are not used with pregnant women and children. Obviously هاي صار عندنا هذا شغلة متكررة إنه الأشياء اللي فياتها replication of DNA. I am very wary to use them in pregnant women. ليش؟ لأنه البيبي قاعد بيعمل DNA قاعد he's replicating his DNA. I do not want to break his DNA replication mechanism. So زي sulfa أو try. This is another DNA affecting drugs. Again, we do not use in pregnancy, or if we have to use it, we use it in a very يعني we'll be very careful if we have to use it. There are other always طبعا في عندنا خيارات أخرى إلى الحوامل. So they can damage the bone and the cartilage mainly, and we try to not use them in children حتى كمان in under the age of 18. This effect of the damage of growing bone and cartilage can even affect adults. وجدوا إن الadults اللي بيستخدموا fluoroquinolones after some time they might a few of them develop Achilles tendonitis, which can cause rupture of the Achilles tendon. we don't know why. حتى كمان إنه صار ينربط اللي هو فلوكسيسين مربوط في certain مثلا cardiac problems even. So قاعدين نشوف إحنا إنه these drugs يعني basic information gives us something, but then clinical information gives us something else. So fluoroquinolones use, obviously you can give them oral IV. طلع كل شيء بستخدمه عليه من prostatitis كتير صعب إنه نوصلها. It needs something that has high tissue penetration. This is one of the things that you can use for prostatitis: respiratory, bone, soft tissue, GI, ophthalmic infection حكينا. So these are the side effects that we mentioned as well. So quinolones are quite well absorbed when given orally and are widely distributed throughout the body زي ما حكينا. What's new here? narrow spectrum زي ما حكينا nalidixic acid on the gram negatives هو أكثر واحد مستخدمه. The broad spectrum Cipro, Levo, norfloxacin, ofloxacin, and the compound with further enhanced spectrum هدول جداد شوية. Clenofloxacin is something that is moxifloxacin كمان صار له سوق كمان. So this improved activity, it has some activity against Pseudomonas and gram-positive cocci زي ما حكينا. So the improved activity for broad spectrum إنه انتقل من gram negatives اللي هو nalidixic acid احفظها N nalidixic acid negatives, and then moved to more positive gram-positive compound عفوا bacteria including the Pseudomonas. Further activity against gram-positive cocci وضيف anaerobes. زي ما احنا clindamycin is our classic drug that we use against anaerobes. So clinfloxacin also is one. So that's just way of thinking about these fluoroquinolones. هلا flucytosine is not a fluoroquinolone. Flucytosine is an antifungal that inhibits DNA synthesis. This is حكينا بيشتغل على inhibiting thymidine synthetase, which obviously will limit the supply of thymidine ما عندك thymidine, so you have lost basically the ability to replicate your DNA. It is used in combination مع amphotericin B. رح بتاخدوه بالمحاضرات الانتفاعية I think the next semester. وحكينا this is a classic drug that is used against candidal and cryptococcal infections. So flucytosine كتير مهم. It is not used alone because of resistant mutants عادة مع التعطي هذا مع amphotericin B. هلا drugs that target mRNA synthesis. فحكينا RNA rifampin. So rifampin has two classic uses. نستخدمه لازم نتذكرهم. الأول is used primarily for the treatment of tuberculosis and leprosy. Both of them are caused by Mycobacteria tuberculosis and Mycobacteria leprae. So in combination obviously with other drugs. بتشوفوا كتير إذا بتحضروا برامج مثلا House MD or whatever is now being موجود بحبوا هذا الدراما إنه a patient has presented to the ER ودخل على ER وعنده signs of meningitis وطلع عنده meningitis and then they freak out and we have to prophylactic treatment بسكروا ER وبيعملوا هالحركات وأبصر شو. So this is actually some more or less true. We have to contact trace هذا البيشنت وعيلته والدكاترة اللي قربوا عليه كمان, and we give them a prophylactic dose of rifampin. عادة هو بنعطى rifampin بنعطى because it has an excellent presence or penetration in the saliva بالupper respiratory tract. هو الموجود وهم هذول أغلب الباجز اللي بيعملوا meningitis موجودين بالupper respiratory tract, منهم Neisseria and Haemophilus influenza. So it is also used in combination with other drugs in the treatment of prosthetic valve endocarditis caused by S. epidermidis, which is عادة with limited success. So with the exception of the short-term prophylaxis of meningitis is given in combination for other drugs because of the resistant mutants that appear at high rate when it's used alone. So we do not use it by itself. كيف بيشتغل حكينا RNA polymerase is very easy. So you're not making mRNA, you're not making any. So كل ال DNA ما لها معنى because you're not making any. So you are replicating the DNA, but the cells are replicating, but they're not making proteins, they die. So rifampin لونه أحمر. So obviously حكينا موجود هو بالسلايفا, بصير السلايفا لون أحمر, حتى sweat might be red, even urine. بخاف الناس منه إنه شو صار معي هذا ومننجايتس وهاكي هذا كله. But obviously it's not, it's just a harmless side effect, and is زي ما حكينا excreted in high quantities in saliva, which makes it the ideal prophylactic agent for these gram negatives that might inhabit the upper respiratory tract. Other formulations أشياء اللي يستخدموا أو مصنعة من الريفامبينز اللي هو rifabutin, which is useful for also mycobacteria, but this is another bacteria called avium intracellular, and rifabutin does not increase. ما بدناش ندخل كثير بالتفاصيل. ديفيسيد كثير مهم نعرفه. ديفيسيد في داكسوميسين inhibits RNA polymerase of C difficile. It is used in the treatment of pseudomembranous colitis and in preventing relapses of this disease. It specifically inhibits C difficile and does not affect the other gram negatives in the normal flora of the colon. هاي كتير مهمة النقطة. حكينا مثلا لما كنا نحكي عن doxycycline، حكينا عن كثير these other broad spectrum antimicrobial مثلا Cipro. Almost all the broad spectrum antimicrobials, all of them share the ability، لأنهم أنت بتاخدهم كثير منهم بتاخدهم oral، حتى لو ما كانوا oral they will cause destability of the balance in the GI tract. بمعنى إنه أنت عندك مثلا عدد معين من الانايروبز، عدد معين من الفاكولتيتيف انايروبز، عدد معين من الجرام نيجاتيفز وتفصيلاتها، شوي جرام بوزيتيفز. So you have this balance and quantity and diversity، كتير مهمة diversity of bugs in the colon. Side effects اللي that shared by all the broad spectrum antimicrobials is that they will cause destability of this balance. راح يقتلوا مثلا كتير من الجرام نيجاتيفز، ممكن ما يقتلوا الانايروبز، او يقتلوا كتير من وات ايفر. يعني بكون عندك مثلا الاعداد of unique bacteria مثلا خلينا نحكي 10,000 and then you give a drug and then suddenly هذا بني آدم من 10,000 صار عنده اليونيك 3000. So all the benefits that you had from the other 7,000 اللي راحوا you will no longer have them forever unless you get them back. واحنا حكينا انت مهم تجيب هذا اسمه الميكروبيوم. Where do you get your microbiome on your skin? Where do you get your microbiome on your respiratory tract, in your gut? if you remember we talked about the colostrum, the first اللي هي الرضعة الأولى اللي بياخذها الطفل. So that as the baby is breastfeeding بياخذ السكين فلورا من أمه by touching his mom. لما يشرب حليب الأم، خاصة أول رضعة معبية هاي أنتي ميكروبيا ميكروبيوم بكتيريا which will line his sterile gut. So once you have all these diverse and very precisely balanced bacteria, if you give these broad spectrum antimicrobials you are destabilizing this balance. If you happen to cause the destability to shift towards anaerobes كتير, the most difficult anaerobe to deal with is Clostridium difficile اللي تعمل لك pseudomembranous colitis. So once you have pseudomembranous colitis it's very hard to treat. يعني بسموها C difficile من difficulty. It's very hard to treat. One of our things هو deficit issue نقدر نستخدمه ضد ال C diff. So C diff is a very very major problem in hospitals. Very major problems in hospitals in patients that are given antimicrobials. هلا ندخل على نحكي عن ال drugs that affect the cell membrane. خلصنا DNA synthesis. So إذا تذكروا حكينا مثلا there are a few antimicrobial compounds that we can use directly on the cell membranes. Polymyxins. هلا cell membrane, if I affect a cell membrane phospholipid bilayer, is it a selective target? Obviously not. I have phospholipid bilayer, but I have lots of proteins in mine. Theirs have different proteins, so there is this structural and chemical similarities between make it difficult to provide sufficient selective toxicity. So they are very highly toxic. يعني فكر فيها شو بيعملوا هذولا؟ they disrupt the cell membrane بيعملوا holes in the cell membrane زي perforins and then cause the cell to die. So they are very highly toxic. They have potent anti-pseudomonal activity, but they are still high toxicity. Their systemic use is contemplated. بس احنا بنستخدم عادة the most common drug of these polymyxins اللي هو colistin. Colistin is one of the last line of defense drugs هم اللي بنستخدمه ضد multi drug resistant gram negative. So بنحطه هذا مع الكاربابينمز، بنحطه مع الاميكيسين اللي هو the our one that we use the aminoglycosides. بنضيف عليهم هلا الكوليستين as well. Daptomycin on the other hand هل الكوليستين gram negatives. Daptomycin is something that we use for the multi-resistant gram positive. It is still a destabilizer of the cell membrane, but has a role in the treatment of infection of multi-drug resistant MRSA. So we can use it for complicated skin and soft tissue infections. ليش skin and soft tissue? Because this is where gram positives are present. والخاصة اللي هي Staph aureus that sits on the skin. It is your normal skin flora. So هلا ضفنا بدنا نجمع كل الدراجز اللي جمعناهم. أول إشي بنستخدمه for the gram positives حكينا. So I have gram positives. They are resistant to the MRSA وما غيرهم. So the first thing that you use is vancomycin, teicoplanin هذولا. بعدين تذكروا حكينا اللي هو الدافتوبريسين والكينيبريستين, the streptogramins. حكينا عن اللينزوليد, tigecycline, ceftaroline from the cephalosporin as the main ones. هلا بدنا نضيف عليهم اللي هو الدافتوميسين. And now we have finished our list so far of the ones that use against the gram positives. اللي هم gram negatives حكينا ضفنا colistin, carbapenems مع الاميكيسين. And this is our these are our last line defense that we used against gram negatives. هلا نحكي عن آخر I think we're almost finished. We are mentioning now بدنا نجمع. احنا حكيناهم كلهم so far, but بدنا نحكي عنهم, نحكي عن their own activity also. The antimicrobacterial agents. So احنا حكينا streptomycin, the aminoglycosides, ضفنا عليه rifamycin أو rifampicin. So these are the ones that we have. بنضيف عليهم the common drugs اللي هم isoniazid, ethambutol and pyrazinamide. كل هدول عادة بيعطوا in some formulation or another مع بعض ب different combinations بنحكي عنهم, which are commonly found antimicrobials regimens هلا بنحكي عنهم, and obviously كمان the other microbacteria when in leprosy. Cycloserine and p-aminosalicylic acid were formerly used, but now they have because عندهم resistance عليهم resistance كثير ما بنستخدمهم. Some fluoroquinolones حكينا ممكن نستخدمهم. Some macrolides we might also use with the rifamycin and the streptomycin. So isoniazid works by inhibiting mycolic acid synthesis. ففكروا فياته الايزونايزد, فكروا فياته زي الانتي بيبتو انتي بيبتيدوغلايكان بالجرام بوزيتيفز. هلا في بيبتيدوغلايكان بالانتي مايكروبكتيريال ولا يعني so but it's the main part is هو mycolic acid موجود في in their cell wall. So this is the one that inhibits the cell wall اللي هو فكروا فياته, هو هيك فكروا فيها انه هو الايزونايزد. So in the very same manner زي ما بيستخدموا البيتا اللي هم شو اسمه عفوا اللي هم البيتا لاكتامز. So this is the beta lactam of antimicrobacterials. So the active drug is probably the metabolite of isoniazid, which we do not really fully know because deletion of the gene for these enzymes results in resistance for the drug. So you need this gene to produce this protein that causes the death of these bacteria. The main side effect of this is liver toxicity. Liver toxicity can be caused by any antimicrobial because you need anyone that is used that is that the body detoxifies this drug by the liver. So if it's used مثلا the cytochrome system or any of the enzymes in the liver, if it overwhelms the liver, it will cause toxicity. منهم اللي هو الايزونايزid. So some people might give it pyridoxine, pyridoxine to prevent اللي هو neurologic complications that may arise from isoniazid use. Ethambutol, the other one, هذا bacteriostatic and مش معروف بالضبط كيف بيشتغل, but it's another one that can affect the mycolic acid synthesis and it's linking with the peptidoglycan layer. عندها peptidoglycan layer, عندها mycolic acid, بربطهم مع بعض بالسيل وول تبعي. So ethambutol is the other one here. And الأخير اللي هو pyrazinamide, which is bactericidal and it's used in the treatment of TB, but not in the treatment of the atypical TB mycobacterials. pyrazinamide له كتير أهمية إنه يستخدم ضد السيمي دورمنت organisms. رح نحكي لقدام إذا تذكروا بالباثولوجي يحكوا لكم إنه the granuloma that is formed by TB مثلا caseating granulomas, وهاي الجرانيولوما هو عبارة عن الجسم بيحاول to wall off this infection. هلا جوا هاي الجرانيولوما زي بيشبه البايوفيلم فورميشن، انه الخلايا جوا البايوفيلم لجوا becomes dormant وبصير الميتابوليزم تبعها كتير باطي. فاذا الميتابوليزم واطي الابريكيشن واطي السيل وول برودكشن واطي، فمعناته the effect of drugs will be again low. So these are called the semi-dormant organisms in this case, and pyrazinamide has effectivity against these semi-dormant organisms. So pyrazinamide acts by inhibiting fatty acid synthesis to prevent the synthesis of mycolic acid. So isoniazid, ethambutol, pyrazinamide are the cell wall affecting drugs for mycobacteria. So iso هيهم TB drugs. حكينا rifampicin is the one that is not on the cell wall, septogrammin, streptomycin the other one, والبقية هم my isoniazid, my ethambutol and my pyrazinamide. All of them here, and this is their mode of action. هلا نحكي عن other miscellaneous antibacterial agents ونخلص المحاضرة. Nitroamidazoles اللي هم الأزولز, these are the antifungals عادة. They are very prominently antifungals, antiprotozoals and antihelminthic drugs اللي هم منهم amphotericin B بتضيف معهم amphotericin B and flucytosine, بتضيف عليهم الأزولز. So those inhibit antibacterial activity as well. The ones of them they affect they call 5 nitroamidazoles. هلا if you use not oxygen, you use something another molecule other than oxygen as an electron acceptor. For those that have redox values, these drugs will cause DNA strand breakage. منهم مين اللي بيستخدم هذول not oxygen as an electron acceptor will be obviously the anaerobes. So منهم اللي هو أكيد كلكم تسمعوا عنه اللي هو الفلاجيل أو metronidazole. This is a very common drug that is used to treat gut infections. ولأنه حكينا we will mention again إنه anaerobes are common dominant bacteria in the gut. So usually imbalance will have an overgrowth of anaerobes, and flagell عادة بنعطى in this case. So metronidazole is a bactericidal against anaerobic bacteria. This is our second مع clindamycin usually given for anaerobes. ما تحكي لي deficit بنعطى للأيروبس. Deficit is usually used only is only reserved for C. diff. بتقدر تستخدم الميترونيدازول لمعالجة السي ديف as well بالإضافة للديفيسيد اللي هو ريفاميسين. Periodontitis يستخدم كثير في periodontitis. It is also effective against Giardia and Trichomonas, so protozoa as well, which are عادة هدول مثلا بنعطوه for women that have vaginal overgrowth of مثلا infections or so on. This drug has 2 possible mechanisms of actions. We do not know exactly, but the specificity for anaerobes حكينا acts as an electron sink, it accepts the electrons بتنافس ال non-oxygen species to accept electrons. So that's how it works against anaerobes, or that's the proposed mechanism. The second mode is it relates to the ability to inhibit DNA synthesis, so it may cause strand breakage زي ما حكينا بالسلايد اللي قبليها. So these are the proposed mechanisms of actions. Nitrofurans بنضيفهم هدول as the agents عادة the main agents يستخدم for urinary tract infections. One of the main agents that يستخدموا because they have less side effects than the sulfa drugs مثلا, or Cipro, or maybe some of the beta lactams that you may use. Nitrofurans they have high availability in urinary tract. It gets secreted into the urinary tract quickly, and it accumulates and has high concentration in the urinary tract. So this compound acts on the DNA through a reduced metabolite بيشبهوا nitroamidosols. Antifungal agents I'm not going to go in full details here, but what we need to know, amphotericin B, and who one of the most prominent ones. It disrupts the cell membrane of these antifungi. راح تاخدوها بالفصل القادم, but we just want to cover our tracks here that it affects the membrane because of its affinity to ergosterol, which is a component of the fungal membranes, but not of ours or the bacterial cell membranes. Azoles اللي هم الفلوكانازول, كيتوكانازول, هدول azoles as ما حكينا are the main ones that are the second main one. So antifungal drugs, these are the main two ones. Miscellaneous griseofulvin على سبيل العطل hair and nail infection by dermatophytes. Again, we will take this in the second semester. I think that's all I want to know. This is just a quick cover for antifungal agents. We just want to know griseofulvin, nystatin, azoles, amphotericin B, and flucytosine. These are the ones that we mentioned. The main ones that we use, these are the main infections. راح تاخدوهم: Candida, Cryptococcus. Dermatophytes, Aspergillus, are the main ones, and this is a good table to keep for this semester and the next semester that will help you in the summary of the spectrum of activity of antifungal agents. And that concludes this lecture. We will see you inshallah next lecture.